here we are today in Gandhinagar for the G20 Health Ministers meeting. It is the culmination of the health meeting of deputies. We have had 3 G20 meetings, and this is the fourth one. We have 3 priorities, as all of you know. One of them is One Health and antimicrobial resistance, and how to use the One Health approach for both pandemic preparedness and response, and also for antimicrobial resistance. Here, what we are looking for is support from all the countries to have surveillance systems, which are national surveillance systems, in which we are looking for integrated surveillance of humans, environment, and animals for any possible pathogens. And then different countries would share their data if there is any outbreak. If there is any outbreak, we are looking for that within the country, different sectors will come together, animal sector, plant sector, human sector, and jointly investigate those outbreaks in labs which are biosafety level 3, biosafety level 4 labs according to the need. And we are creating a national network like this. For other G20 countries, we are asking them to do the same and also work towards that. This will be very important for our Honorable Prime Minister's vision that he has given us of one earth and one health and one future, because we all share the same earth. We have to have one health between the different creatures. We are linked with plants, animals through various issues of transmission diseases, but also because of our food chain, what we eat, what we do. So having these different sectors work together is core, and then having networks with all countries on this issue is very important. So that's the first priority. The second priority is in terms of medical countermeasures. So research and development, again, networks not only within the country, but also with all the G20 countries, some sort of sharing of information, sharing of knowledge, so that we can learn from each other and we can produce countermeasures which are in the form of vaccines, therapies, or diagnostics or devices that help us fight the any outbreak that happens in the future. In that, India has a very important role as a major manufacturer, particularly a major manufacturer of generic vaccines and a very major manufacturer of vaccines. So how do we do this in a way that we can not only be prepared for India, but also help the rest of the world in the spirit of our Honorable Prime Minister's vision of the world is one family, or Vasudhaiva Kutumbakam. So the third one is again where India has great leadership, which is digital health. So we are trying to ask support of all the G20 countries for making digital public health goods, which means that whatever we create in public health is a public health good. It can be shared and without cost to everybody, so that it can benefit. Examples that what we have done is like an example of CoWIN database, where we were able to give vaccine certificates and have data on not only know that we vaccinated 100 crore people, but also have a complete database of who was vaccinated, when and where. So this type of digital goods, we want to make public health goods. And we are seeking everybody's consensus on that. Thank you.